Okay, these are the tools I'll be using, and the patient, and the room, and the strange setup, and my ID. Okay. All right, we're gonna get started. I'm gonna sanitize my hands, and I'm gonna say hi. My name is Jennifer. I'll be your nurse practitioner student today, and would like to do a full head to toe assessment on you and record you for educational purposes. You do consent to this?
Yes.
Okay. All right. First thing I'm gonna do is I'm going to the nurse did check your vital signs before she came in. Your temperature was 98.6 degrees Fahrenheit. Your heart rate was 72. Your respirations were 18. Your pulse was your blood pressure was 110/70. And your pulse oximetry was 98% on room air. And those vitals are all normal for a woman of your age. And no concerns there. Okay. Put that down. So next I did watch you walk into the room. You had very precise gait. No issues with mobility, balance, and you were able to walk one foot in front of the other with a steady gait. No issues with mobility. You were able to get on the table, not a very tall table, you're on the table without problems. And I'm just going to give you a quick look over as I'm here. We're going to assess that you are sitting very erect, you are well nourished, and can you tell me your date of birth?
5678.
Okay, and she does appear to be younger than her stated age. The next thing I'm going to do is I'm going to look over her skin. I'm going to see that all of her skin is intact, no open areas. Her skin is warm. Her skin is warm and dry. I'm going to assess her turgor in her hand. No signs of dehydration. There you go, both of them. No signs of dehydration. I'm going to check your capillary refills, and there is no issues. They are each less than a second. Okay. Hands, no problems, no calluses, no irritation, no bulging vessels. I'm going to look at her legs now. I do not see any edema. No edema, no varicose veins, no irritations, no rash, no indentations. And I'm going to check cap refills on the toes as well. Okay. And all within normal limits, less than 1 to 2 seconds. Okay. And while I'm here, I'm also going to check sensation. Before I forget, I'm going to check each extremity and tell me if it's soft or hard and what extremity I'm touching.
Okay.
Okay, so you're going to feel this is soft and then this will be hard.
Okay.
Okay.
Left arm soft. Right arm hard. Right leg hard.
Okay.
Left leg soft.
Okay. Perfect. So that is sensual. She has perfect hair sense. The senses are good in the extremities. No changes there. Next, I'm going to, after I sanitize because I touched her toes. All right, I'm going to feel the head. Head is atraumatic, normal cephalic. I'm not feeling any abnormalities, no rash, no irritations. Her hair is thick and soft and well distributed. I'm going to feel down by her ears. I'm going to feel her maxilla and frontal sinuses. Any pain when I palpate?
Nope.
I'm going to percuss now, a little firmer.
Nope.
Okay. And I'm going to have you open your mouth. Any pain or clicking in the jaw there? Nope. I assessed her TMJ. Okay. Next, I'm going to go on and I'm going to look at her in more details into her eyes. I'm going to take your glasses for a minute. And I am going to look at your eyebrows, and your eyelashes are very thick, evenly distributed. No scales, no irritation noted. Can you close your eyes for me? Eye closure is efficient. Okay, no ptosis, no irritation, no edema. I'm going to have you look straight at me. And I'm going to have your sclera is white, conjunctiva is pink and clear, and your pupils are bilateral, and your eye movement is symmetrical. Okay, first I'm going to check I'm gonna take my glasses off too. I'm gonna check her ophthalmoscope assessment on her here. I'm gonna turn this to 0. I'm gonna have you look straight ahead, and I'm going to pick the opposite side there. All right, with your right, I'm gonna look with my right. I'm gonna go right to the cone of light, or I'm sorry, to the red light reflex. And I'm gonna sneak right in there, and I'm gonna see the vesicles, and there is no AV niche noted. I can see your cone, not your cone, your cup and your disc. Sorry. And no cox either. And no cotton wool spots, no hemorrhages. And your cup is like a milky white, light pink color. I'm going to check your other eye now with my, okay. Sorry, so I'm going to do left to left. Actually, I cannot do left to left. Okay. And I'm going to again, just like the other eye. Thank you. Okay. And there is your red light reflex. Okay. Alright, so I don't blind you when I'm listing them off there. I do see as in the other eye, I do see your cup, your optic disc, and there's about a 0.5 ratio in both eyes. They are milky white in color with a little pink, no hemorrhage in either eye, no cotton wool spots, and that is it. No hemorrhages noted, and the AV nicks, and no AV nicks noted. Okay? Would you like your glasses back on?
Sure.
Yeah. Well, I'll take better glasses on. Okay. Next, I'm going to look in your ears. I'm going to start in this one. Sorry. Show them on the side. Alright, so I'm going to assess, actually, I'm going to do her bilateral ears first. I'm going to assess your bilateral ears. Yep, sorry. Bilateral ears, I'm going to assess the pinna. I'm going to assess the auricle, the lobe. Any pain around palpating?
Nope.
Okay, I'm not feeling any abnormalities. I'm going to look at the outer canal, no drainage, redness, irritation. I'm going to look in the canal here, and there is no, the canal is light pink, minimal cerumen, and no irritation or redness or swelling. There is no tympanic membrane here. There is just large amounts of scar tissue, and that is our normal finding for her. The tympanic membrane is ruptured in this ear is for years, but I would, if it was intact, I would see a tympanic membrane light gray in color, and that would have a cone of light at a 7. Now I'm going to come to this side. Again, I'm going to assess the outside of the ear, any pain for the palpation, your tragus. I'm then going to look in your ear canal. Okay, yep. Alright, no irritation noted, no redness, and you do have a tympanic membrane with a cone of light at 5 o'clock. Tympanic membrane is light gray in color and no problems noted. No irritation. Okay, and we'll assess that more when we do the cranial nerves. Okay, now I'm going to assess your nose. I'm going to feel the outside of your nose. No pain, no irritation. I'm going to look, her septum is midline. I'm going to see her tuberants are dark pink in color, no swelling, no exudate noted, and mucous membranes are moist and intact. No irritation, no evidence of nosebleeds. Okay, now I'm going to take a look at her mouth. Okay, so I'm going to take a look in. Ready? Thank you. All right, so you have approximately 32 teeth. They are off-white in color. No teeth are missing, no chips. Teeth are smooth. Your buccal mucosa, or buccal cheeks, pink and white, or pink and moist. I can also see your anterior posterior pillars. I can see your, I'm going to go down low. I can see where you would have tonsils. And I can see your anterior and posterior pharynx. Okay, you can close your mouth there. I did also see your soft palate and your hard palate, your gums, no signs of gingivitis noted. I saw the floor of your mouth is no problems, and your tongue is a little pink with a little rough as it's supposed to be. Okay, and your tonsils, like you say, we'll put it at a grade 0 since they're missing. All right. And next we will do the cranial nerves. So I will start with, I'm going backwards, I'll never know. Oh, okay. So I'm going to start with, I'm going to have you cover up one nostril and close your eyes. And go ahead and take a deep breath for me. Oops. Can you identify the smells?
Sandalwood.
Okay. Sorry about that.
That's okay.
All right. And next, yep, opposite nostril.
Toothpaste.
Yes, not as pretty as sandalwood, but it does the trick. Okay, that is the olfactory nerve, cranial nerve 1. Okay, so I'm going to have you lightly cover up one eye. All right, tell me the furthest line down you can read.
ECTPNL.
Okay, switch eyes.
ECTPNL.
Okay, and with both eyes?
ECTPNL.
Okay, so that is 20/20 in both eyes and with both eyes open. And that is optic nerve 2. I'm sorry, that is cranial nerve 2, optic nerve. Now we're going to check for your cranial nerves 3, 4, and 6. That is going to be your ocular motor, your trochlear, and your abducens. Sorry. Okay. I'm going to have you follow my little Q-tip there, and we're going to go 1, 2, 3, 4, 5, 6. And then just follow it just with your eyes. And they accommodate. Yep. And then I'm also going to use the light to check to see if your pupils are equal and reactive. And I'm going to put your glasses up just for a second there. Okay, I'm going to have you look right at my nose. Not look at my nose. Okay, pupils are direct, they accommodate, and they are consensual. And I do not see any nystagmus noted, and your eyes move bilaterally when we were doing the extraocular motions. Okay, and so that was 3. You can put your glasses down now if you want. That was 3, 4, and 6. That was ocular motor, trochanter, and abducens. Okay? All right, now I'm going to touch part of your face, the same thing with the soft or hard, and tell me what part of your face I'm touching and if it's soft or hard. Okay?
Soft forehead. Soft cheek. Hard cheek. Jaw. Hard jaw. Cheek hard.
All right.
Forehead hard.
Forehead hard. Okay. Sounds good. And that was trigeminal number 5. That is, so cranial nerve number 5, trigeminal's intact. Now I'm going to do the facial.
Sorry.
You're fine. Okay, so the facial one, I'm going to have you raise your eyebrows. Okay, wrinkle your forehead. There you go. I'm going to have you smile. All right. And then I'm going to check your mastica. Just keep smiling. Okay. And I'm going to have you frown. And push your lips out. Okay. Perfect. So cranial nerve number 7 is intact. Cranial nerve number 8 is the vestibular cochlear. And this is the hearing. So I'm going to get behind you and I'm going to say 2 words after I cover one of your ears. Whoops. Okay.
Dog man. Man dog.
Okay. Perfect. Now I'm going to strike the tuning fork and tell me if you can hear it equal in both ears or better one than the other.
Equal.
Okay. And while it's still going, very loudly, can you hear that on your mastoid bone?
Yes.
Okay. Tell me when you can no longer hear it.
I can no longer hear it.
Okay.
Yes.
Sorry. Alright. Tell me if you can no longer hear it.
No longer hear it.
Okay. Alright.
I can no longer hear it.
Okay.
I can hear
I'm
it.
not sure why that's so loud there, but okay. Can you still hear it?
Yeah.
Okay. So that means that your air conduction is about twice as long as your bone conduction, and that is a normal finding. So your vestibular cochlear cranial nerve and cranial nerve 8 is intact. Cranial nerve 9. Okay. We're going to pretend that I'm going to have you go ahead and swallow. Okay, and I felt her thyroid gland at that point go up and down, and her trachea is midline. Okay. And that was cranial nerve 9. Cranial nerve 10 is your vagus nerve. Sorry. All right. You're fine. Okay. Open your mouth for me. Say ah. Okay. All right. I see your uvula goes up symmetrically. All right. I'm going to have you cough. Okay. Good. So that is the vagus nerve, cranial nerve 10, and that is intact. So now I'm going to get behind you, and I'm going to have you shrug your shoulders. Okay. And then I'm going to have you push your face into my hand and turn the other way. Okay. That is accessory cranial nerve, and that is cranial nerve 11 intact. And then stick your tongue out for me. Move your tongue up, and then down, side, and then put your tongue back in your mouth and check it for the cheeks. Okay, intact. So that is cranial nerve 12, the hypoglossal, and that is intact. I don't think I mentioned that when we did take the swallow, that was cranial nerve 9, and that was glossopharyngeal. So I just wanted to make sure I mentioned that. Otherwise, all your cranial nerves are intact. And now I'm going to roll down, and I'm going to check your carotids. Actually, I'm going to check your lymph nodes real quick. Well, tell me if there's any pain or irritation. I'm down here, so I'm going to do the preauricular. I'm going to do the postauricular. I'm going to do the occipital. And I'm going to come down and do the posterior cervical and the anterior cervical. And I'm going to have you turn your head. I'm going to get your deep cervical and your deep cervical. And I'm going to do your supraclavicular and your inferior clavicular. And then I'm going to come up here to your tonsillar. And I'm going to do your submandibular and submental. Okay?
Yes.
And that is your lymph nodes. Any problems with palpation there?
No.
Nope. Okay, so now I'm going to go right to the carotid. I'm going to feel a nice strong carotid pulse at about a +2. And I'm going to feel on this side as well. Nice strong carotid pulse at a +2. And when I'm doing pulses, I'm going to continue down. I'm going to do the brachial. A nice strong +2. Radial. Nice strong +2 pulse. Okay. And I'm going to do the dorsal pedis. Nice and strong. And posterior tibial. Okay, nice and strong. All right. And then when I'm up here, I'm going to listen for bruits. I'm going to first assess around the thyroid, then the carotid. So I'm going to have you take a deep breath and then hold it. Okay, nothing on the carotid. All right, I'm going to take one more on the carotid there. Okay. Okay. All right. No bruits noted or appreciated. All right. I'm now going to assess for the point of maximal impact. So I'm going to start here at your point point of Lewis and go down, and it's about mid-clavicular. Thank you for assistance with your boobs, with your breast. And that is her point of maximal impact right there. Okay, and if you could lower those. Okay, so now I'm gonna listen at I'm gonna listen at the pulmonic. The aortic. And the mitral. No. I'm sorry, not the mitral. The tricuspid mitral. Okay, then I'll listen at the bell. And this is aortic. Pulmonic. Oh, that's okay. Tricuspid. Mitral. Okay. Sounds good. And I'm going to also check for heaves and thrills. So I'm just going to feel there. Not feeling any vibrations or any abnormal sounds. When I was listening to your chest, I did notice that you had a strong S1, S2, no adventitious heart sounds noted, no gallops, no murmurs. Okay, and that is it for the heart. So now I'm going to have you stand up, and we're going to do the respiratory. Everybody's favorite part. Okay. I'm going to start by just listening with the diaphragm for our basic. All right. If you get dizzy or lightheaded, let me know.
I'm good. Just
Okay. Take a couple of breaths. Take a deep breath. Okay, good. Okay, I'm going to have you turn around. Okay, perfect. Deep breath. Okay. All right, there's 4 more there. Okay. And to give you a little break, I'm gonna check what's called tactile fremitus. I'm going to put my hands on your back and I'm gonna have you say 99.
99. 99. 99.
Okay. And you turn around. Okay, say it again, 99.
99. 99. 99.
Okay. I'm gonna have you take a deep breath. I'm gonna check your thoracic expansion. Okay, I'm gonna have you turn around again. All right. Okay, Dan, one more time. Okay, and that is about between 3 and 4 centimeters there. All right, while I have you situated this one, I'm gonna listen with the bell. Sorry, with the bell of the stethoscope. Okay, ready? And go ahead and take some breaths whenever you're ready. Okay. Okay. Can I have you turn around one more time?
Mm-hmm.
Okay. And I'm going to listen again. So go ahead and thank you. And one more. Okay. All right, and now I'm going to percuss. So I'm gonna tap. Okay, and under. Okay. Yep, thank you. Okay. All right, and now I'm gonna have you say E, E, E while I listen to all your lung fields. All right, go ahead whenever you're ready.
E, 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 E,
Okay, go ahead and turn around for me. Okay.
E, 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 E,
Oops, hold on.
E, E.
Okay. Sorry, I got held up there. Okay. I can have you go ahead and sit down now.
Okay.
And I'm gonna have you lean back. I'm gonna check about 45-degree angle. Okay, and turn your head this way. Okay, and this way. All right. No jugular vein distension. While you're down there though, why don't we just finish laying down all the way? Not the world's most comfortable area. Promise we'll make this as quick as painless as possible. Okay, and now I'm gonna examine. I did it from that side. Am I fitting? Yeah. Okay. Just getting a right angle for the camera here. So now I'm going to examine her stomach. I'm going to see that there is no stretch marks, there's no irritation, skin is intact, there's a little mark here from pregnancy. Otherwise, I'm not seeing any jaundice, no irritation noted. I'm gonna listen. To all 4 quadrants. 1, 2. All right, and while I'm here, I'm gonna also listen for bruits. So I'm gonna listen for the aorta. I'm gonna listen for the renal on this side. Unheard. Okay, now I'm gonna listen for the iliac. And the femoral. Okay. All right, so now I'm going to lightly palpate. Take off stethoscope. So I'm just going to lightly palpate. Any pain where I'm pushing there?
Nope.
Okay. And now I'm going to deeply palpate here. Just get a little deeper there. Okay, this would be where your bladder is. If I push down far enough, we would both notice. Okay. And then over here would be your liver. If I felt anything, this would be the liver I'd be investigating. Up here, I'd be investigating the gallbladder. Over here, I'd be investigating the spleen. Actually, while I'm over here, I am going to put my hand down here. Maybe take a deep breath in and hold. And I am not feeling a kidney over there. And I'm going to actually do it from this side as well. And I'm not feeling anything. Okay, which is a normal finding. All right, now I'm going to percuss the entire abdomen. Much more tympani over on this side. Okay. So we can see the tympani where the air is in the intestines, and up here where the organs, where the abdominal organs are, it's a little more dull. All right, and I'm going to check for a liver, the liver span. About right there. So I'm going to take her finger and place it there. And then I'm going to go up and I'm going to measure, and I've seen this many times, that is about 7 centimeters there. Okay, so I've listened, palpated. All right, I think that is it. All right, if you want to sit up. Yeah.
Hold on. I got to turn first.
It's okay. Oh. Sorry, maybe better to put your legs over.
Oh.
Jesse, when we originally purchased this table, we were not thinking we were doing physical assessments.
No, we were not.
All right. So now I'm going to assess your extremities, did your pulses. All right, so we are going to start next with your extremities. So I'll have you move your fingers, move your hands, move your wrists, move your elbows and your shoulders. Oh, okay, good. Against resistance even. Okay, I'm good. And I'm going to have passive range of motion and passive range of motion. Okay, and then your elbow. I'm going to move your elbow up and put your arm back. Okay, and while I got you here, I'm going to just go ahead and have you push your hand against mine. Push your hand down. Okay, now I'm going to, I was kind of shaking your hand there. All right, and check, actually I'll check your muscles together. I'll do active and passive this way. I'll just do passive. Okay, and your arm. And your shoulder. Any pain or anything when I'm moving it?
No.
Okay. All right, so I'm going to do the muscles together. So I'm going to have you squeeze my fingers. Okay. I'm going to have you try to lift your hands up. Okay, push down. All right, I'm going to have you get in this stance. So I'm going to have you push towards me. Try not to pull back. Okay. And shoulders. Stick your shoulders out. Try to push up. And try to pull down. Okay. Your muscles are at a 5. You're really strong. All right. That is a normal finding. Okay, I'm going to check your brachioradialis. So just relax. Okay. And I'm going to check your bicep. And your tricep. Okay. And next I'm going to check your brachioradialis. Okay, and then just relax your bicep and your tricep. Okay, next I'm going to have you move your, I'm going to have you stand up. I'm just going to have you pick your leg up and wiggle and kick. How's that?
Yeah, put my pants back.
Oh, sorry. So just kind of pick your leg up, wiggle, there you go. Okay, next leg. You need a hand standing up?
No.
Okay. Perfect. All right. Now I actually am going to have you sit back down now. Active range of motion, no problems there. All right, now I'm going to move your leg. Any pain with movement out, in,
Nope.
and down. Okay. I'm going to move in, out, up, down. Legs, ankle, nope. Okay. All right, what I'm going to do now is I'm going to start from the bottom up. I'm going to have you push down like a gas pedal. I'm going to try to pick your feet up. Okay. Now I'm going to have you try to kick your legs out. Okay, pull them back in. All right, I'm going to have you pick your thighs up. Pull your thighs out. All right, push your thighs in and push your thighs down. Okay. All right, pain is out of pain. My pain. Your muscles are at a 5 out of 5. Very strong. Okay, I'm going to tap your popliteal. Just have your feet dangle. Okay. And I'm going to do your Achilles, and your plantar surface, and your toes are curling under. Perfect. While I'm down there by your feet, though, I am going to check your hands. I don't think I did your carpal. Did I do? I think I did do these. Okay, I'm going to check your capillary refills. And then when I'm down by your toes, all right, I'm going to check your capillary refills. They're less than 1 second. Now when I have your toes here, I'm going to have you put your toes down. Okay, I'm going to lift your toe up and down. Tell me if you can feel it move up or down. Tell me what direction. Keep your eyes closed and just with your senses.
Up, down, up.
Okay, next one.
Up, down, up, Down.
Okay, perfect. Sensation is intact there. And now we're going to check it with the tuning fork to see if you can feel the vibration. So let me know if you can, feel it.
Yes.
Tell me when you can no longer feel it.
No longer feel it.
Okay. Correct. Okay. Can you feel it?
Yep.
Tell me when you can no longer feel it.
No longer feel it.
Okay. All right, perfect. And that was checking for vibration, and that is intact. All right, I'm gonna have you stand straight up. Checking mobility a lot. All right, I'm gonna have you do the pronator jerk. I'm gonna have you put both arms out and close your eyes. And I'm gonna see that she is still able to remain in an erect pose with her arms out. Okay, now go ahead and you can open your eyes for a second. Put your arms down by your side. And this is the Romberg. Okay, close your eyes. And this is to see how well she can hold herself. And she's doing just fine. Okay, next thing is I need you to put your knee on your shin and move it down. Knee on your shin and move it down. Okay, to check for sensation. Next, I need you to move your arms up and down. Okay, now I'm gonna have you clap your hands. Okay, right hand is dominant. And then I'm gonna have you touch your finger to my finger to your nose. Finger, nose, yep, moving it on purpose. Okay, all right, checking perception there. Okay, we're doing good. All right, I'm gonna have you have a seat then. And we are going to, I'm just gonna do a little mental check here. And I'm gonna have you remember 3 words. Bed, blue, sock.
Bed, blue, sock.
That's it.
Okay.
All right, tell me your full name.
Chrissy Raposa.
All right, tell me your date of birth.
5678.
All right, tell me your phone number.
231-564-0360.
Okay, and tell me what we're doing here today.
Headed to assessment.
Okay, and can you tell me the name of the president?
Biden.
Okay, can you count back by 7s starting at 100?
193, 86, 79, 72.
Okay, that's okay. You're showing off now. Okay, sounds good. Can you tell me your address?
266 County Road 571.
Okay, do you know where you are right now?
Bel Air.
Okay. All right. And can you draw a clock here for me and make the time 6 o'clock? Perfect. So she did in fact draw a clock and it is 6 o'clock. Okay, can you remember those 3 words that I gave you to remember? Or those 3 words I asked you to remember earlier?
Blue bed sock.
Perfect. All right, so that is the memory, cognition, and she is intact. And the last thing I want to do is I want to tell you that you did great. All your tests were good today. And I want to make sure that we are getting outside. We're getting aerobic activity probably 3 times a week. That'll be good for your diabetes, your mental health, and to keep you overall active. And that's it. Like I said, just try to get out about 30 minutes a day, 3 times a week to begin with, and even more than that. It's beautiful. Other than that, I want to say thank you, and thanks for letting me do your assessment.
Have a great night.
You too.